discovered a bullseye rash on my arm.
At the time, I'm sure I just thought it was an insect sting.
From being mildly sick to very sick within a couple of weeks.
And he told me it was all in my head.
Most of us look normal.
There's a hidden danger in your backyard, right where you and your family live and play. It's so small you might not see it until it's too late. It's called Lyme disease, and it's spreading fast. Not just in rural areas, people in suburbs and even cities are at risk. The worst part? Most people who have it don't even know. So what is Lyme disease? How is it spread, and how can you protect yourself and your family? In this video, we will try and answer some of those questions. But first, how much of a threat is Lyme disease to public health?
About 22,000 cases of Lyme disease have been reported annually in recent years in this country. That represents about 1/10 of actual cases of Lyme disease that meet the CDC criteria. So that means there's about 220,000 cases of Lyme disease. That's new Lyme disease each year.
And it doesn't matter how old you are, adults, children, the elderly, even the family dog can all be infected with and spread Lyme disease.
I lost my memory almost completely. Didn't know where I lived or what my kids' names were or anything else there too.
The symptoms aren't always the same for everyone, but the reality of Lyme disease can be frightening. Things that affect everyday life far more than the simple rash about 70% of patients notice first. The rash looks like a bullseye. It can appear several days or several weeks after infection. In some cases, expanding to several inches across. Other rashes and lesions may follow. Other signs include fever, chills, headache, muscle and joint pains, and swollen lymph nodes.
So I first knew I had something when I was up an apple tree one day, when I suddenly got tremendous headaches and awful sweats and shakes there too, and I had difficulty climbing down there. Anyway, I went to the hospital where I worked, and fortunately the medical director was also an infectious fevers specialist, and he happened to diagnose that I had Lyme disease.
From there, things get worse. Joint pain can develop into severe arthritis. Neurological problems begin. Dizziness, insomnia, memory loss, problems concentrating, numbness, tingling, and heart palpitations. Most people get Lyme disease from infected ticks. A small organism enters the bloodstream, potentially spreading through every major system in the body, from the brain to the heart. You may not even remember being bitten by a tick in the first place, or ever see a rash. People infected with Lyme disease can also transmit it to other people through sexual contact or body fluid transfer. Perhaps the most frustrating aspect of this story is that Lyme disease is frequently misdiagnosed as something else, like chronic fatigue syndrome or fibromyalgia. Some people suffer for months or even years before getting the help they need, and even then, patients may never be fully cured. Tens of thousands of new Lyme disease cases are reported to the Centers for Disease Control every year, a number that continues to grow. But finding a Lyme-literate doctor is critical to getting proper care. Once a patient has been diagnosed, the first step is usually a course of powerful antibiotics, often given intravenously. Several years ago, a vaccine was developed, but it was never proven reliable and is off the market. Even with treatment, many people suffering from Lyme disease continue to have symptoms for months, even years. Though it was first identified decades ago, knowledge of Lyme disease in the medical community remains scarce. Research and funding equally so. Many patients have formed support groups and held rallies over the years, trying to draw attention to the need for better education and understanding of this debilitating and chronic disease. If you think you may have Lyme disease, demand a full evaluation from your physician even if he or she disagrees. It never hurts to get a second opinion. Remember, there are thousands of people just like you out there who understand what you're going through and can help. The most powerful tool against Lyme disease is prevention. Ticks live in wooded areas with lots of brush and are active all year round in all 50 states. They're small and easy to miss and view people and animals alike as the perfect meal, filling their bellies with blood. When spending time outdoors, try to avoid walking through dense underbrush and tall grasses. It's also important to use insect repellent, something with a high concentration of DEET. Such products are available at most grocery and sporting goods stores. Always check your clothing and skin for ticks, even after spending time in your own backyard. Check your pets as well. They can be infected with Lyme disease and bring ticks into your home.
If our dogs are getting infected with these bacteria, we're in the same environment as our dogs are. And so this sets off some warning bells to look for us.
They're romping with your children, and so therefore they're in the same places. If they're picking up the disease from rolling in the leaves or whatever else that they're getting into, then perhaps your children are going into those places with them.
Everyone wants to live in a nice house in suburbia with trees in the backyard and wildlife. Those are the Lyme disease environments. Lyme disease is coming right up to our back door.
If you find a tick, it's important to remove it properly. Never try to burn one off. That could cause the tick to regurgitate into your bloodstream, increasing your chances of infection. Instead, use tweezers to carefully pull ticks away, grasping them as close to your skin as possible. Try not to crush the tick's body and wash the affected area thoroughly when you're done. If you've been bitten, keep a close eye on the bite's location and monitor your health closely. Remember, ticks live in the same places we do, and new cases of Lyme disease are popping up all over the country. Lyme disease destroys lives. Beyond the painful and often mysterious symptoms, it can lead to lost work, family problems, and depression. Take an active role in your community. In your churches, schools, clubs, and organizations, make Lyme disease education and prevention a priority. Protect yourself when you go outdoors, whether you're working, hunting, playing, or just going to a family picnic, because ticks are out there. And they carry more than just Lyme. For more information about co-infections, other tick-borne diseases, treatment options, and support groups near you, point your browser to www.tickedofandfedup.com.